Welcome to Utah Medicaid. Now that you have been approved for Medicaid, we would like you to complete a Medicaid class. This class teaches you about your benefits and copays and how to choose health and dental plans where needed. Residents of mandatory enrollment counties are required to choose a health plan. The mandatory enrollment counties are Box Elder, Cache, Davis, Iron, Morgan, Rich, Salt Lake, Summit, Tooele, Utah, Wasatch, Washington, and Weber. In all other counties, you may choose a health plan or use the fee-for-service network. All members receiving full dental services must choose a dental plan. If you need an interpreter, call 1-866-608-9422. The information in this slideshow may change at any time without notice. Complete an education. Medicaid members living in Davis, Salt Lake, Utah, and Weber counties should call 1-866-608-9422 or 801-537-9222 to schedule an in-person class. The class generally lasts less than an hour and is offered Monday through Friday at various times and locations. The class is very helpful, and you can talk to a health program representative, or HPR, about any questions or concerns you have about your Medicaid benefits. If you are unable to attend a class in person, or if you live in any other county, please continue with your online education. Wherever you live, you will need to call an HPR to make your health and dental plan selections at the end of this presentation. As a Medicaid client, you have responsibilities. You must use providers that are in your plan's network in order for your services to be covered. If you use providers outside of your plan's network, you may be responsible for the bill. Tell providers you have Medicaid when you make an appointment, and tell them your health plan if you have one. Be sure to keep your appointments or cancel in advance to avoid being charged. Medicaid does not pay for missed appointments. Also, please respect your doctors and their staff. It is really important to listen to what they say. If you have a copay, it is due at the time of service. And remember, you should be familiar with your rights as listed in the Medicaid Member Guide. The Medicaid Card. The front of the Medicaid card shows your name, ID number, and date of birth. The back of the card has phone numbers and websites for members and providers to verify eligibility and plans. Each household member will have their own Medicaid card. For those expecting a baby, note that unborn babies will not be issued a Medicaid card until the birth has been reported to DWS. Do not throw away your Medicaid cards. If your case closes and is reopened, new cards will not be mailed. Check your card and report any errors to DWS at 1-866-435-7414. This number is on the back of the card. Here is some important information you need to know. You must show your card at every visit to avoid being charged. So take your Medicaid card and photo ID to every visit. Providers should verify eligibility at every visit when the Medicaid card is presented. If you are eligible for past months, show your providers your card and ask if they will bill Medicaid. They do not have to accept your card for past services. Medicaid does not give refunds. If you already paid the bill, talk to your provider to see if they are willing to bill Medicaid and give you a refund. If you haven't received your card or need a replacement card, call DWS. The benefit letter will look similar to the letter shown here. This letter is a summary of your plan selections and benefit information. It also has copay messages, phone numbers to contact your plans, and other important information. The letter is not proof of eligibility. Show your provider your Medicaid card, not your benefit letter. A new benefit letter is mailed when your health or dental plan changes, your benefits change. There are changes to your other insurance. Keep the letter until you get one that is updated. Health plan information. A health plan is a group of doctors, clinics, hospitals, and other medical experts you will use for your medical care. You will have up to 4 health plans to choose from. If you already have doctors that you see, ask them which plans they accept. An HPR can also help you find this information. All health plans have the same benefits and copays. Sometimes when someone is unsure of which plan to choose, they ask us, which plan is the best? The best plan for you would be the plan your doctor and other medical providers accept. Each plan has different providers. You must see providers who take your plan or you'll be responsible for the bill. Some of the health plans give their customers a small ID card. If your plan gives you an ID card, show it with your Medicaid card and picture ID to receive services. Plan change requests can be made within the first 90 days or during an open enrollment period. Open enrollment is only for those who live in the mandatory enrollment counties mentioned on the first slide. It is usually from mid-May to mid-June each year. If you wish to make a change, contact an HPR to see if you can. Because plans are not required if you live in any other county, those residents can make plan changes outside of open enrollment. Dental plan information. Medicaid members who are pregnant, disabled, or qualify for check benefits have full dental benefits. Dental plans are required for all Medicaid members with full dental benefits, no matter which county you live in. A dental plan is a network of dentists that you will use for your dental care. All dental plans have the same benefits, and there are no copays for covered dental services. If you already have a dentist, call them to see which plan they accept. You may see any dentist that takes your dental plan. If you will be on a dental plan, that plan will mail an ID card to you. Show it with your Medicaid card and picture ID at each visit. You may see any dentist or specialist within your network. You can change your dental plan within the first 90 days or during an open enrollment period. If you wish to make a change, contact an HPR to see if you can. Open enrollment is usually from mid-May to mid-June each year. Other insurance. Other insurance may be health, dental, or vision insurance you have through a job, a parent, or another source, or it could be Medicare. Report any insurance, Medicare information, or terminated insurance to the Office of Recovery Services, or ORS, at 801-536-8798 and to DWS. Your insurance information will print on your benefit letter. Whenever you receive an updated benefit letter, check it to be sure the most current information is listed. The number for ORS also prints on your benefit letter. Call ORS if you have any questions about your insurance or if there are changes. Other insurance and/or Medicare will be billed first and Medicaid last. You must show all insurance cards and your Medicaid card along with a picture ID when receiving services. Where possible, use providers that accept both your Medicaid plan and your other insurance. This page reviews copays. It is important to know your copay amounts, and you should pay this at the time of your visit. Pregnant women, children, American Indians, and Alaska Natives do not have any copays. For all other Medicaid clients, there is a $4 copay for doctor and urgent care visits. Prescriptions are $4 each, and there should be no copay after the first 5 because there is a prescription maximum of $20 per month. Hospitalization has a $75 copay for each non-emergency hospital stay. You may click the copay link below this video to review the complete copay chart. Medicaid clients do not have copays for dental, family planning, mental health, transportation, eye exams, or for labs, x-rays, medical equipment, and supplies. And now, about your benefits. Some services require prior authorization, but your provider takes care of this when it is needed. If the prior authorization is denied, you have the right to appeal that decision. Medicaid does not require a referral to see a specialist. However, some specialists have their own policy that requires a referral. Ambulance services are covered for emergencies only. See your Medicaid member guide for other transportation options. Birth control is covered without a copay. Click the birth control link below this video for a list of options. CHECK benefits. CHECK stands for Child Health Evaluation and Care. CHECK is about keeping children healthy. Anyone from birth through age 20 with traditional Medicaid is eligible for CHECK services. Make sure to ask your doctor to complete a CHECK exam for your child. CHECK offers well-child visits with your child's doctor, immunizations, vision and hearing screenings, dental checkups by your child's dentist. Follow up on anything discovered during the visit. Children may receive additional benefits that are not usually covered by Medicaid. Read your Medicaid member guide for more information about CHECK services. Click the CHECK link below this video for when your child should have a well-child visit. Dental benefits. Pregnant women and those eligible for CHECK and most disabled members have dental benefits. They include exams, cleanings, x-rays, fillings, root canals on some teeth, and silver crowns. Medicaid members who are not disabled or pregnant or not eligible under CHECK only get limited emergency dental care. It is very important to know when to use urgent care versus emergency care. Some urgent care examples are a sprained wrist or ankle, earache, bad cough or fever, severe vomiting, or a very sore throat. Urgent care is used for things that need to be taken care of right away, but they are not life-threatening. All health plans have urgent care facilities for you to use for these conditions. Some emergency care examples include heavy bleeding, chest pain, trouble breathing, bad burns, and broken bones. You may be charged for non-emergency use of the emergency room. If you have a serious medical issue and it is not safe to wait, go to the emergency room closest to you. Emergency room services are 12 times more expensive than urgent care. If used inappropriately, you may be responsible for the whole bill. Please be aware that your health plan will pay for urgent and emergency care out of town if the provider is willing to bill Utah Medicaid or your health plan. There is no routine coverage out of state. Eye care. Medicaid covers a yearly eye exam. Pregnant women and those who receive CHECK benefits have limited coverage for glasses. Contacts are not covered. Check with your health plan to find a vision provider. Maternity care. The baby must have the same plan as their mother through the month of birth. If you need to change the new baby's plan, contact an HPR. Call DWS as soon as possible to report the birth of your baby. Medicaid covers prenatal visits and needed tests, charges for labor and delivery, anesthesia, pain treatment, the hospital stay, a 6-week checkup after the baby is born, tobacco cessation services, dental, and vision services. Mom may be covered for up to 60 days after delivery, and baby may be covered for 1 year. Take advantage of your dental, vision, and other traditional benefits during this time because they may not be available to you after those 60 days. If you have had a baby born too early or too small, talk to your doctor about a drug available to reduce the chance of this happening again. Circumcision is not a covered benefit. Mental health care. Medicaid automatically enrolls you in a prepaid mental health plan, or PMHP, based on the county in which you live. Medicaid only pays for mental health services when you go through your PMHP. PMHPs are responsible to provide mental health care in a hospital, outpatient mental health services, and outpatient alcohol and drug services. Your PMHP and phone number print on your Medicaid benefit letter. Call them for more information about your benefits. You can find out more information in the Medicaid Member Guide. Prescriptions. Use a pharmacy in your health plan network if you have a health plan. Otherwise, you can use any pharmacy that accepts your state Medicaid card. Not all drugs are covered. Check with your health plan for their approved drug list. Some over-the-counter drugs are covered by Medicaid. A prescription from your doctor is required. Medicare and Medicaid. If you have Medicare, it will be your first insurance and Medicaid will always pay last. Medicare Part D covers prescriptions for people with Medicare. Medicaid does not pay your prescriptions if you have or are eligible for Medicare. Very few prescriptions are covered by Medicaid for people with Medicare, though they do include some over-the-counter medications prescribed by your doctor. Call the Senior Health Insurance Information Program, or SHIP, at 1-800-541-7735 for free help understanding your Medicare benefits. SHIP can help answer your questions about Medicare coverage and benefits, Part D Medicare plans, and Advantage Plan enrollment. Now for some reminders. The Medicaid Member Guide contains more information about your benefits. Medicaid Member Guides are usually available at live Medicaid orientation classes, or you can go to the website below to see an online copy. You must report new or terminated insurance to DWS and ORS. These phone numbers are on the back of your card. If you need a replacement Medicaid card or to report changes in your situation, call DWS. If you have a medical billing issue, contact your health plan. If you have a dental billing issue, contact your dental plan. To request a plan change, call an HPR or health program representative at 1-866-608-9422 or 801-537-9222. Health plan options. If you have a doctor or use any medical services, call their office or an HPR to see which plans they accept. Or you can use the links below this video to see what health plans are available in your county. The web addresses for each plan are listed for you to visit and search their provider list. Find your county and click that link. If you live in a county that says mandatory, you must choose a health plan. In all other counties, you may choose a plan or remain on the fee-for-service network to see any Medicaid provider. Family members can have different plans if they use different providers. And remember, all plan benefits and co-pays are the same. Dental plan options. All pregnant or disabled members and those with check services will need to choose a dental plan. If you have a dentist, call their office to see which plan they accept, or see the plan's web address below and check it to search their provider list. Family members can have different plans if they use different dentists. You have two dental plan choices, MCNA and Premier Access. All plan benefits are the same. The web address for each dental plan is provided on this page. And finally, choose your plans. You must pick your plans or they may be assigned. You must use providers that accept your chosen or assigned plans. Those who live outside of the mandatory enrollment counties who do not choose a plan will remain on the fee-for-service network. To choose your plans, call an HPR at 801-537-9222 or toll free at 1-866-608-9422 Monday through Friday, 8 a.m. to 5 p.m. And that concludes our Medicaid presentation.